Lie number 1. Gender-affirming care for kids is life-saving.
Gender-affirming healthcare for transgender kids is a best practice and potentially life-saving.
So-called gender-affirming care for kids has only been mainstream for a few years. We're told by activists that it's literally life-saving, that kids who are not affirmed will likely commit suicide. Yet, there just isn't any evidence of closeted trans kids committing suicide en masse worldwide 20 to 30 years ago, before gender-affirming care was adopted, with a sharp decline in deaths after mass adoption started, roughly in the last 5 to 10 years, in those countries that adopted and popularized gender-affirming care. Something we'd expect to see if the claim was truthful. Yet, such data simply don't exist anywhere in the world. If anything, in the US, child suicide rates have continued to climb, with a 5-fold increase in preteen suicide attempts between 2010 and 2020, precisely in the time frame when gender-affirming care was gaining traction as the preferred treatment. Studies also show that trans people remain at higher risk of suicide compared to general population after they transition, quite possibly due to the fact that transition does not resolve underlying depression, anxiety, and other psychiatric conditions present in more than half of the trans population. In fact, not only there aren't any data or studies that demonstrate that gender-affirming care is life-saving, there also aren't any studies that reliably demonstrate that gender-affirming care is even effective as a medical treatment at all, which I will address in another video.